Good day, this is Professor Will, CBMD PhD, and today's Wednesday, December 15th, 2021. It is 9:53 and 1 second p.m. Eastern Standard Time. Today's research, appendicitis. So let's hop to it here. Antibiotics can be first-line therapy for uncomplicated appendicitis cases. A review of studies shows that antibiotic therapy is effective in up to 70% of cases that do not have added risk. Date December 14, 2021. Source: Duke University Medical Center. With numerous recent studies demonstrating that antibiotics work as well as surgery for most uncomplicated appendicitis cases, the non-surgical approach can now be considered a routine option, according to a review article. The surgery, usually done laparoscopically, remains a definitive option for otherwise healthy patients with a severely inflamed appendix or other factors that increase the risk of rupture. Acute appendicitis is the most common abdominal surgical emergency in the world, striking about 1 in 1,000 adults. Until recently, the only treatment option was surgery, so having a non-surgical approach for many of these cases has significant impact for both patients and the healthcare system. The researchers say the criteria for determining the best treatment approach is nuanced, but not excessively difficult. Appendicitis cases, marked by abdominal pain, that often migrate to the lower right side, nausea and vomiting, and low-grade fever, are confirmed with ultrasound and or CT scans. And if these scans depict no complications, most of these patients can receive antibiotics instead of undergoing an appendectomy. Antibiotics can also be first-line therapy for patients who have severe symptoms, but who are older or have medical conditions that add risk to surgeries. Researchers think there's going to be 60% to 70% of patients who are good candidates for consideration of antibiotics. A lot of people know that patient preferences can be brought into the decision, so it is important to provide the literature and educate the public. Researchers added that antibiotics are not always a complete cure in about 40% of cases. Patients who recover from a bout of appendicitis after receiving antibiotics have another episode and eventually need their appendix surgically removed. It is important to take into account every case in its unique context as we consider patient preferences. If someone presents with appendicitis and they are attending their brother's wedding the next day, antibiotics may be a good option. If they have appendicitis and they are planning to head to rural Alaska next year, they might want to consider an appendectomy, given that the condition could recur. Good day, this is Professor Will, CBMD PhD, on microbiology, bioinformatics, and pathophysiology. This video was created for educational purposes only. Hope you enjoyed listening. Until next time, have a great day.